COVID-19 is an epidemic of proportions we haven't seen since 1918's Spanish flu, which infected a third of the world's population at the time and killed roughly 50 million people. COVID is a new virus. And because this virus, similar to the flu, follows a pattern called exponential growth. If a lily pad doubles in size every day, and it takes 60 days for the lily pad to take up the entire pond, it would not take up half the pond on day 30. It would take up half the pond on day 59. COVID spreads by touching infected surfaces and then touching your face. But you can combat this by washing your hands frequently. It also spreads when an infected person breathes on someone. Droplets from their saliva carry the virus up to 6 feet. Symptoms of COVID-19 include fever and chills, cough, shortness of breath, fatigue, and losing your sense of smell. Before I continue, the reason I wanted to make this video was to shine light on some misconceptions, and generally to try and help some people understand what this virus is really about. And I'd like to point out that I don't want to attack anyone who is not currently social distancing. 40% of all COVID hospitalizations were people between the ages of 20 and 54. Well, it's true that if you're under 65 years old, you're less likely to die from COVID, but that doesn't rule out being quarantined in a hospital, or just how lethal this virus is for the elderly. They aren't the only people at higher risk, however. The time between catching the virus and showing symptoms can be anywhere from 2 days to 2 weeks. If every person passes it to 3, and that happens in 10 layers, I have been responsible for infecting 59,000 people. This is an example of the lily pad analogy from earlier, but the simplest way to slow the spread, other than avoiding large gatherings, is to wear a mask. Wearing a mask is not a political statement. It's not a sign of weakness or fear. It's simply a sign of respect. We need to start the economy back up as soon as possible, but we don't want to start it back up prematurely. Lifting too many restrictions too soon will likely result in the hospitals being overloaded. They can only take in so many people. It's finding a balance between fighting unemployment and preventing our hospitals from becoming overwhelmed. COVID-19 will not last forever. Dr. Anthony Fauci predicts we will have a vaccine ready for the public by January 2021. If everyone watching right now can do just one thing to help slow the spread, I promise you, together, we will have saved hundreds of lives, if not more.